Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana Harinque if you're new here, and if you're not, thank you for coming back. Today is September the 1st. It is Wednesday, and today we're going to talk about the situation around COVID-19 in Alabama. This is something I know we've kept up with for, it sounds crazy to say, a year and a half now, but that's the situation, and we know things have not been going well in Alabama recently. Today, I am joined by Decatur-Morgan Hospital President Kelli Powers. If you're not familiar with the area, that Decatur-Morgan Hospital is in North Alabama. And today, Kelli's going to talk with us a little bit about how her hospital is handling COVID-19 patients and how her staff members, especially her nurses, are really taking a toll here, both emotionally and physically. Now, Kelli, I'll go ahead and say thank you for joining us today. Thank you for kind of shining a light on this and on the healthcare workers specifically. We had a story yesterday where you gave us some of your numbers. We'll go over those in a minute, but you specifically talked about nursing shortages. So can you tell us a little bit about that nursing shortage that you're experiencing right now?
Yes, we are experiencing nurses shortage, and it's not just here in Alabama, it's nationwide. But with the amount of patients that we have, it makes our shortage, worse. So currently we have 67 inpatients in Decatur that are positive, and I have 10 in ICU, 9 on the vent, but I also have 9 other patients on the vent. So not having those nurses makes it very difficult to take care of the patients. Some nurses have left to travel, which hurt us, mainly other states. And then some nurses have just left the profession altogether because this is draining on them and their families. And not just our nurses, but our physicians and our other staff.
Now, I got those numbers from you a minute ago, so I want to repeat them. You said that you have 67 patients hospitalized with COVID-19 right now. You also have 2 others that are presumptively positive for COVID. You have 9 of those patients are on a ventilator. And there are also, though, 9 other patients on a ventilator. And when we say that, those are not COVID related. It's easy sometimes for everybody to see these numbers in the hospital and say, oh, well, we got a lot of hospitals. Hospitals are big. Hospitals have a lot of beds. But sometimes I think people forget that hospitals are not just for COVID right now. People are still, unfortunately, experiencing other medical conditions, different types of trauma, like car accidents and things like that. So how have you and your staff and just your hospital capacity dealt with adding the surge in COVID patients to what you already have to deal with on a daily basis?
Well, we're trying to think outside the box and do as many different things as we can. One, we would like to keep patients out of the hospital as much as possible. So, again, my plea for vaccination is always out there, but that's the number one way that we can keep you out of the hospital is to be vaccinated. We also have monoclonal antibody infusions that we've increased that. So when people find out they're positive, if they have certain underlying health conditions, we try to get them immediately to get the infusions to keep down the number of patients in the hospital. But we've tried our best to, get patients in nursing homes, rehabs, send people home with home health, whatever we can do to try to limit the amount of inpatients we have, especially due to staffing. One thing I wanted to tell you, Ivana, that's different now than, in the fall and in January. Back then, we had the stay-at-home order. So a lot of the other patients, people, elderly people slipping and falling and breaking their hip, they were staying at home. That wasn't happening. There wasn't as many trauma, car wrecks and things like that because people were not getting out. We didn't have stomach viruses and all these other things going around that we do now because people are really and truly, getting out, not wearing their masks, not washing their hands, not social distancing. So we're seeing it's sort of a double whammy. We have all the COVID patients, and the Delta variant is it's such a highly contagious strain of it that, more people are getting it than before. And it's also children and pregnant people too. So that adds another level of patients coming in. So I think the overwhelmingness that we're seeing now is putting all of that together on a staff that was already tired and worn out from before and having to deal with it again.
That's a good point. We didn't see a lot of those car accidents like we did, like we're seeing now last year when people were not driving as much. You mentioned slip and falls. You mentioned other types of things that just happen inevitably when you go outside. That's just part of life, unfortunately. But since we weren't going outside that much, we didn't have as many of those cases. So you combine that with COVID, and you mentioned the Delta variant being so much more contagious, and we're seeing kids get this virus at a higher rate. So
Yes.
I know you add that on top of the bed shortage that you already have and we have across the state. And I want to add to these numbers you gave me a minute ago, there are 45 of your employees who are quarantining and 54 who are self-monitoring for symptoms there. So that's 45 employees of your already short-staffed hospital who can't come to work.
Yes, it is. Yeah. And that makes it tremendously difficult for the ones that are still working to take on more work. So we're having to pay incentives and bonus. And, we pay travel pay too. We just do it internally here for people to work. So, and begging them, I think I may have mentioned when I did my press conference the other day, we have nurses working 60 hours a week. That is hard, on somebody in the type of work they do. You think about it, you have to be on point all the time, making sure that, all your medicines are correct, safety measures are there. You have to move patients and constantly do all these things that are very draining as a nurse or a tech. And not only that, housekeeping and other things. It's a hard job. And not only that, it's mentally challenging as well. And I know you want to talk a little bit about that, the mental aspect and how we're dealing with that.
I do. And you mentioned, I'm glad you mentioned that though, about the 60 hours a week, because that's a lot at any job. But you mentioned that you have to be on point in a nursing, a tech, physician, any type of medical situation. It is not like you're sitting in front of a computer. You can kind of slack off a little bit. This is a job where lives are literally at stake. You cannot mess up because somebody might die if you mess up. That pressure has got to be immense in every way. Then you add that pressure to 60 hours a week, maybe a weekend. And when I say weekend, I don't even mean Saturday and Sunday, maybe 2 days off at some point as a weekend, and then you jump right back into it. So physically, it's hard to imagine. Mentally, how are your staff members doing?
They're worn out. We are doing counseling. We have a consulting counseling company coming here, meeting with them weekly. We have a pastor that makes rounds daily throughout even on the COVID units, to try to pray with people and help them through this time. And we're trying to do all kinds of things we can to, maybe be positive, like, give them T-shirts and food and, encouragement and whatever we can do. But at the end of the day, I think their main frustration is that we do have a vaccine available that can stop some of this. And I want to tell you, this is something that has bothered me ever since one of the nurses told me. She said, I am so tired of having to call someone in their 20s to get them to give me end-of-life decisions, for their 40-something-year-old parent. Those are decisions that 20-year-old children shouldn't have to make when we have a vaccine that could have kept this person alive. And she said that's where you get, I think, into the mental too, seeing the dead bodies go down the hallway time after time again. It's draining because nurses and physicians and techs, all of our staff, they're trained to help people and heal people. And when you can't do it, then it really gets you, very frustrated at that point. And we don't want to see death. I don't want one more person to die, and I think that's the word that needs to get out, that these are not elderly people. These are not obese people or people with, diabetes. These are healthy individuals who have COVID and their lungs just are giving out on them. They could have prevented it if they had taken the vaccine.
When you talk about do no harm, that's the oath that everybody takes in the hospitals, in a medical profession, do no harm. And I'm sure that it is hard for medical professionals, again, and then staff in general, to see people who they might believe are harming themselves by not being vaccinated and by having to make these, having to have this outcome. Now, and two, I will say, you said that there's 9 COVID patients on a ventilator and then another 9 from other reasons. And I will go ahead and say that if anybody has ever seen anybody put on a ventilator, you would feel differently about it. It is one of the most horrifying things you can witness. And that's something though, again, Kelli, there's people who don't work in the medical field, who don't see things. And I think it's easy for people to have an idea of what they think it's like, what they see on TV, what they see on the news of people who are inside hospitals.
Mhm.
What can you tell people about what it's really like inside the
Really.
hospital, inside the COVID unit?
I'll tell you one thing. In the ICU, we offer prayer before someone's put on a ventilator because the chances of them coming off the ventilator is slim. And, in the beginning, I don't think a lot of people took us up on it, but now, there are people, they're begging, it is really, it's a bad scene. And we can't allow visitors right now because there is so much COVID within the hospital, and we don't want visitors to bring it in with them. And it's hard to know that these loved ones are dying without anybody around them, just our staff. And we do have staff. They do wonderful things, they hold people's hands and, really care about them, but it's different when you don't get to see your family member when they leave. So it's draining. It's mentally draining on not only the nursing staff, but everybody that works at the hospital with that. And again, I just hate it. Another story, we had a 48-year-old guy that was at another small hospital here in Alabama, and we tried our hardest to get him here to Decatur. We didn't have an ICU bed, but they didn't have ICU at their hospital. And before we could go pick him up, he died. It could have been prevented if he had had a vaccine. But just the stress of that, and that's on me. I'm the one getting those texts and those calls at night saying, can you help some of my patients? From other hospital administrators, because they are in dire straits, especially in the small rural hospitals.
Well, we know that there are people nationwide, especially many people in Alabama, who just have a distrust of government. They have a distrust oftentimes of national figures, national spokespeople, especially around coronavirus and vaccines. But Kelli, you are local. You are in, again, a smaller hospital in North Alabama. What is your message to people who don't trust the vaccines, who don't trust that COVID is real?
It's real. It's real. We see it every day. Ask some friends of yours that are nurses or physicians. Don't look at social media and the internet to do your research. Please talk to a physician or a nurse, somebody in healthcare. If you want to talk to me, I'll talk to you. I know there's concerns with the vaccine, but if you want to live, you'll take the vaccine. This whole virus, we don't understand the science behind why it's killing some people and not others. So the best thing, the protection we have right now is the vaccine. And then if you get it, the other protection that we have is the infusion. But other than that, there's nothing else. One thought I wanted to share with you is, there are patients that die who have cancer. There's patients that die, heart attacks, aneurysms. There's so many other things that kill people, but there's nothing right now that can prevent it. People with cancer, they're begging, and if you compare that to this COVID virus, we at least have the vaccine. We do chemo and we do all kinds of things to help patients who have cancer. But at the end of the day, there's no perfect pill that they can take that just cures it, So with the vaccine, at least you might still get COVID. It's a slim chance, but there's still the vaccines are not 100%. But I can tell you today that if you take the vaccine, the chances of you getting on the ventilator and being in ICU are very, very slim. So why not take it? I know it may come with complications, but at the end of the day, if you don't want to take it for yourself, take it for your family members. Your 20-year-old daughter or your 10 or 11-year-old kid that loses their parent. The average age in our ICU right now is 56. So that tells you it's not 70 and 80, 90-year-old people anymore. These are young people because most of our elderly population is vaccinated. So I just, if we can just save one person's life today, making them think twice about that and then getting their booster shot. Anyone who's had the vaccine that is immunocompromised in any way, please get your booster shot because you may not have as much natural immunity or immunity from the vaccine that you receive. So you definitely need to get your booster vaccine.
And something that you said reminded me of something that Dr. Nafziger at UAB said earlier in the last few months. Time is kind of a fluid thing for me right now. But in the last few months, she said, and I'm paraphrasing, that we prayed for a miracle last year, and now we do have a miracle.
We do.
So why aren't we taking it? So I was going to ask if you agreed with that.
I agree with that. Definitely. We prayed for a miracle. We pray for miracles every day in our hospital. All these 67 patients, are prayed for because they need prayer. We don't know that all of them are going to make it or not. But yes, I agree with you. We have a miracle, and let's use it, to help us. One other thing I wanted to talk to you about is mental health. Mental health has been a challenge, not only in Alabama, but nationwide for many years. And this whole pandemic has really, increased the amount of mental health that we're seeing. We're seeing more and more psych suicides. We're seeing more and more psych patients in our emergency room. And one thing, we've got to get through this pandemic so we can work really, really hard on mental health. Staying at home, virtual learning. I think there are a lot of great things that people have done for workarounds, but they're not good for mental health. Children need to be in school. They need to learn from their teacher and have friends. And, the things that really help mental health, this pandemic has really hurt us. And I really want to hurry up and get through this. And the best way we can is to get people to get vaccinated.
I will leave in the comment thread here a section where if you are experiencing suicidal thoughts or anything like that, you can call that number and get help.
Please.
Kelli, if we have reached anybody, if anybody is thinking about changing their minds, where can they get vaccinated if they're in your area at Decatur-Morgan?
You can go online to vaccinefinder.org and find out where you can get the vaccines. We offer them at our Parkway Hospital. There's a pavilion there. It's 973-2888. 256-973-2888 to call, and you can make an appointment. We do Pfizer or Moderna, but there are a lot of sites. There are a lot of pharmacies that offer it, statewide. So if you can go to vaccinefinder.org, they go there and find your location.
And we have plenty of information too. I can also link on finding vaccines, also information on monoclonal antibody treatment. If you have been diagnosed with COVID and you started your symptoms in the last 10 days, experts say that could be your best chance of staying out of the hospital. So I will leave all that information here. Kelli, thank you so much for shining a light on what it is like in your hospital and unfortunately what it's like in a lot of hospitals across the country right now.
Right. Thank you. Thank you for having me.
Everybody watching, I will leave that information here. If there's anything you need follow up on, if anything that me or Kelli said and you need some explanation on, you need links, etc., please reach out and let me know. You have my email address. So everybody, thank you for watching. We'll see you tomorrow.